Hi, my name is Lynette Beckman.
Hello, I'm Uriel.
Hi, I'm Leanne Bone.
And I'm Amanda Baird. Our group is going to explain what medical sonography, also known as Doppler ultrasound, is and explain some of its applications. But before we go into that, you must first understand what the Doppler effect is. Here's a simple example to get us started on the topic.
Doppler frequency, or Doppler shift, is the change in the frequency of sound waves that occur as they are reflected off a moving object. A real-life example is how you hear a siren as an ambulance is driving towards you, and how the sound changes as the vehicle travels past and away from you.
Pitch is a measure of frequency, and as it was mentioned in the previous video, the pitch or the frequency of the siren was high as the siren or the ambulance was approaching you, and then as it was going away from you, the pitch was lowered. So basically, the Doppler effect is a change in frequency due to a moving source. This change can occur in any type of wave, light waves, sound waves, and even water waves. When an object is moving, the frequency in the direction of the movement increases, and the frequency away from the direction of movement decreases. This occurs even though there is not an actual change in the frequency from the source. The following slides will give you another example showing a bug sitting on top of the water standing still and the frequency that it is emitting, and also the frequencies that change as the bug starts to move to the right across the water. The change in frequencies here is very apparent. Even though many of us have not been familiar with the Doppler effect before today, it has been happening all around us all the time. Medical sonography uses this Doppler effect to its advantage by using the change in the pitch of a sound wave to produce a computer-generated image that provides information about different parts of the body. This occurs in a very non-invasive way, so it's really beneficial to us. In this next video clip, you are actually able to hear the change in pitch from different types of pulses moving through our arteries. The first is of the brachial artery in your arm, and the second is of the carotid artery located in your neck. Enjoy!
Today I'll be talking about ultrasound, or also called sonography. Ultrasound is a safe, painless, not operation, but like procedure that you can get when you go to the hospital. Alright, so when you go to the hospital to get this done, you'll go and lay down and they'll apply gel onto your stomach or wherever the area that they're going to look at. They'll bring out this little, I guess it's a computer with like a whole bunch of stuff on it. So they'll just roll it out and stick it next to you. They will take out the transducer and the transducer prod. The prod will be applied onto the gel, because if it's not onto the gel, the sound waves will not go through your skin. The gel is the factor of it going through the gel. Going and getting the imaging. Alright, so a sound wave will be sent from the transducer to the transducer prod. The sound waves will be shot out of the transducer prod into your body. These sound waves are too high pitched for our human ears to hear. So it would be like a whale sending out sound waves to the water, but it's a smaller thing and it's taking images of either your baby or it's getting a diagnosis for whatever illness you may or may not have. So after it's sent through your body, the sound waves will be bounced off whatever organ or whatever part of body it's looking at, because wherever the gel is at, it's only in a little section, so it'll only take a picture of the little section that it's on. After that, the image or the sound waves will be bounced back and sent to the transducer prod, then to the transducer, and then to the computer. The computer will pick up the sound waves and analyze them and produce an image. The images from the sound waves are displayed in flat, thin sections. So it'll look weird, but that's just how it's produced or how it's made onto the computer for us to see it. Sound the ultrasound pictures can be in 3D or 4D. So in Leanne's little short videos, you can see the babies from 3D to 4D and how realistic and how you can get all the details of the baby before it's born on that, which is amazing. Also, the imaging that you get from the transducer and stuff, it takes 10,000 pictures per second to get that, which is crazy. Also, the ultrasound is way different than X-ray. People think it might be the same thing, but it's not. X-ray is used radiation and ultrasound does not. Thank you for listening. Bye.
Hello, I'm Uriel, and I will be talking about transducers. So, transducers are devices that convert energy into another form of energy. There are 5 types of transducers. The first one is active, and these devices do not require any sort of energy to perform their duties. An example of this is thermocouples. These are devices that are used to measure temperature. There are also passive transducers. They generate electricity whenever there is external stimuli acting upon them. Then there are sensors, and these are really basic. These receive and respond to any electrical stimuli or signals. Then there are actuators, and that is basically when the motor is responsible how the system operates. The example that I could give you guys is the computer. Basically, the software in the computer is the actuator because it is in charge of running and all the functions that it should be doing. The 5th type of transducer is bidirectional, and that is when a physical phenomena is transformed into an electrical signal. An example for this is the antenna radio. All the wavelengths that it's receiving is being transformed into the sound that's coming out of the speakers. The transducers that are mainly used for ultrasound fall under the category of active, passive, and sensors. The way ultrasound works is really similar to sonar and radar. First, a probe, which is what you call the device that is used for ultrasound, is placed onto the body. Once it's made contact with the body, it starts to send wavelengths towards the tissue, and once it hits the tissue, it reflects back to the transducer, and that basically is the data that we're receiving and that we are capable of seeing on the screen and stuff like that. Usually there are multiple types of probes. There are convex, linear array, phased array, microconvex, I-type array, biplanar, endocavity, and intraocular. However, the 2 most common types that you'll ever see in a doctor's office are linear array and phased array. Linear array, however, is the one that causes the 2D, and that is basically the mode that most people see whenever they go to ultrasound for sonography to get like the sex of the baby and stuff like that. It's just basically 2-dimensional and the picture you are seeing. However, phased array does play a role on how ultrasound works and how the image is developed, but it ultimately comes out to linear array. Basically the wavelength or the frequency actually that is used for the most common type of ultrasound and sonography is 1 megahertz to 18 megahertz. However, it also depends on what type of ultrasound you are getting. It depends on the body part where the probe is being placed. For some types of ultrasounds, they have higher frequencies, so therefore the wavelength is a lot smaller, or vice versa, the wavelength is a lot bigger, so the frequency will be a lot lower, so you could just get in deeper into the body. However, for the Doppler effect, that one actually has its own mode in ultrasound. It is called the Doppler mode.
So I'm going to talk to you today about the different types of sonography used. We're going to start with neurological sonogram. Very often this is used to image vessels in the brain, blood flow. It can detect any kind of valve problems. It can detect any kind of aneurysm that may occur. Often they run into situations with infants where they've got fluid on the brain. It's generally an accumulation of cerebral spinal fluid, and they can detect that and decide how they want to move forward to alleviate that. The second we're going to talk about is the echocardiogram, which most of us are pretty familiar with. This is imaging of the heart. It looks at the different valves and the blood flow in the heart. It can detect the velocity and the direction of the blood flow. It can let us know if we're looking at congenital heart failure, any kind of defect in the heart, and just the pumping action. This is a little video here that kind of shows us what it looks like in a color sonogram of the heart pumping. Next, we're going to be looking at muscular sonograph. So this is used often in the physical therapy realm, sports medicine. There's an injury to a joint, tear to the muscle, this type of thing. It's most commonly used in sports medicine. Physical therapy as well. The next one we're going to talk about is vascular sonogram. Vascular sonogram is basically focusing on, as you would imagine, the veins within the body. The most common use is detecting like a deep vein thrombosis, which would be a large blood clot in the veins, lower extremities, almost always the leg, but can be anywhere in the body. So you can go through and check blood flow throughout the system. Again, the valves, are they closing accurately, consistent blood flow necessary to go throughout your system to keep our bodies healthy. Again, we're going to talk about abdominal sonography. This is going to hit anywhere in the abdominal area. It's going to bounce off of any kind of soft tissue organ or area. So a lot of times they're looking at kidneys or bladder. And of course, there's always the prenatal obstetrician sonography, which I think most of us are most familiar with. And that's looking at the fetus through the belly before they're born. In this little clip, we have a fascinating view of a 3D sonogram. Starts with the original sonogram and morphs into what it looks like to see the 3D sonogram, which is really quite amazing. You can literally see the features of the child before they're even born. And last, we have physical therapy sonograms. Now, these are used often just topical to the body. It can alleviate inflammation. It can help with curing a bone fracture. Used to administer medicine for those folks who are, afraid of needles or have issues with that. It's used for heat therapy with muscles and strained tendons. And also the fascinating part is that they're using this in the animal world as well. We see it used with older animals or animals that are struggling with spinal injuries. You can just topically apply the sonography transducer across the spine or the muscle. It's non-invasive. It's a technique that's used across the board. So fascinating, wide varieties of sonography used. And I hope that you've come away from this with a little better understanding of what the Doppler sonogram is used for and how it benefits us.